Hello everyone and welcome back. In today's teaching, we're going to be focusing on the mediastinum, which is the central parts or the central compartments of the thoracic cavity located in between the two pleural sacs. So if this is the lung, the diagram illustrating the lungs, and these are the pleural sacs, then essentially this middle aspect is the mediastinum. And this mediastinum contains most of the thoracic organs and also acts as conduits for structures. Now, before we can fully understand the mediastinum, we need to know the basic anatomy of the sternum. Now, the sternum is also known as the breastbone, and it's divided into three different parts, not equal, three different parts. The first one is the mandibular sternum. The second part is the body of sternum, while the third one is the xiphoid process. Now you can see a label in here, which is the junction at which the mandibular sternum joins with the body of sternum. This junction is known as the sternal angle, and the sternal angle is one very vital aspect of the mediastinum, but we'll get there very soon. Now, anatomically, the sternum is divided into two parts. We have a superior mediastinum and the inferior mediastinum. Now, the superior mediastinum is the one superior to this sternal angle, while the inferior is that part inferior to the sternal angle. So for a second, let's place this sternum, this structure, let's place it in front of this. Let's place this in front of this. So that means everything superior to this sternal angle is the superior mediastinum, and all the structures below it is the inferior mediastinum. So essentially what we are saying is that the superior mediastinum extends upwards, right, terminating at the superior thoracic aperture, while the inferior mediastinum extends downward, terminating at diaphragm. So I said earlier that we should take this structure and place it in front of this, right? But after doing that, let's now flip to the side. After placing this in front of this, let's flip to give a side view. Now, if I'm giving a side view, this is what we would have. And that would make this aspect the mandibular sternum, right? And that would make this whole part the body of sternum. Then more inferiorly, we would now have the xiphoid process, right? So once again, this will be the mandibular sternum, this will be the body, and this will now be the xiphoid process somewhere more inferiorly here. For the purpose of this class, we're going to be discussing just the superior mediastinum alone, and that is the parts superior to the sternal angle, right? If you place this here, every structure at the back of this, posterior to this, is the superior mediastinum. Then everything downward, extending downward, terminating at diaphragm, is what? The inferior mediastinum. So now, let's now go fully to explain what the superior mediastinum is, its boundaries, and the content. So the superior mediastinum is bounded superiorly by the superior thoracic inlet. The part labeled here, it's superior thoracic inlet. Then it's bounded inferiorly. It is bounded by the sternal angle, right? Or the inferior mediastinum. So if superiorly is bounded by the superior thoracic aperture, inferiorly is bounded by the sternal angle, which is continuous with the inferior mediastinum, right? Then anteriorly it is bounded by the what? The mandibular sternum, and posteriorly by the vertebral bodies of T1 to T4. So this is the T1, T2, the T3, and the T4. That are the boundaries of the superior mediastinum. So once again, if this is the mandibular sternum, we are saying that everything posterior to it, right, is the superior mediastinum. Don't forget that we are placing this in front of this. So every structure posterior to this is the superior mediastinum. Then all the structure posterior to this aspect is the inferior mediastinum. For this class, we're only focusing on the superior. So that means if this is placed into this and it is now flipped like this, this is the mandibular sternum. That means all the structure posterior to it here is the what? Superior mediastinum. So we are only focusing on this aspect alone for for the purpose of this class. So superiorly by thoracic aperture, then anteriorly by mediastinum, inferiorly by the sternum angle, then posteriorly by the vertebral bodies of T1, T2, T3, and T4. Now let's go to the contents of the superior mediastinum. What are the contents? What can you find? Now it follows the rule of 4 by 4 by 3 by 3. 4 by 4 by 3 by 3. Mean 4 organs, 4 nerves, 3 arteries, and 3 veins. 4 organs, 4 nerves, 3 arteries, and 3 veins. So what are the organs? You can find the thymus, you can find the trachea, you can find the esophagus, and the thoracic duct. Thymus, trachea, esophagus, and thoracic duct. Now, what are the nerves that you can find there? You can find the right vagus nerve, left vagus nerve, right phrenic nerve, and left phrenic nerve. So once again, right vagus nerve, left vagus nerve, right phrenic nerve, and left phrenic nerve. Now, what are the arteries? You can find the brachiocephalic trunk, you can find the left common carotid artery, and also the left subclavian artery. And what are the veins that you can find? The right brachiocephalic vein, left brachiocephalic vein, and the upper parts of the superior vena cava. So I believe that with this, you understand the general anatomy of the mediastinum and more particularly the superior mediastinum. So if you have any questions, kindly drop them in the comment section and I'll do it to respond to them. Thank you so much and see you in our next class.